The work that I currently do at the World Federation under the banner of health is overseeing the running project that World Federation has, and then any request that comes from the community or from outside the community, be it for individual patient or for setting up new health centers. And I, together with the health manager, Siddiqa Bai Karim, we will then do a need assessment, do a project proposal, and if it's a viable project, then we go and look for donors and set up the scheme. We try to help anybody who fits the criteria. And if I can brief you what the centers we have got running, we have got the health centers and the annual eye clinic. We've got 3 annual eye clinics running at the moment. One is in Lucknow, one is in Miawali, Pakistan, and one is in Patna. The Zainabia Health Center we've got in Patna in Bihar, we've got in Potanahalli, which is 2-hour drive for Bangalore, and we've got in Lucknow, and we support the health center and breast screening center in Miawali. As far as health is concerned, we look at where the need is. Al Mehdi Extension Project is part of Miawali. What Al Mehdi wanted was to train members of the community to become paramedics, to uplift them economically. For that to happen, they needed to extend the hospital, because at the moment they only got 16-bed hospital, and for them to qualify to be registered as a training hospital, they needed 32 beds. So it's not only extending the facilities that the hospital provided. The primary objective of this extension was so that they are registered as a training center, so we can then train our community members to become paramedics, nurses, and radiologists. Lucknow has got a primary health center as well, known as Polyclinic. And the reason we call it Polyclinic is because they've got homeopaths, they've got physiotherapists, general practitioners, and health officers, where they treat patients at a nominal charge of 5 rupees with medication. And this came about because there were a lot of quacks treating patients for 5 rupees. And we thought that we can't allow members of the community to be trained by non-professionals. And that's how Zainabia Polyclinic came into being. Annual Eye Clinic was founded more than 25 years ago, and the first one was in Bangalore. We have got 4 annual eye clinics running at the moment. The idea was that a lot of people were suffering were visually impaired because of cataract, and this is such a treatable condition. So that was the main reason why annual eye clinic was started. But there is a silent disease as well, which make people blind, and that's glaucoma. The annual eye clinic also screen for glaucoma, which if treated just with eye drops, it's just normal eye drops, very cheap, it will prevent irreversible blindness in the community. World Federation gets requests for medical equipments every now and again. Every request is looked at individually, a need assessment is done, and if the equipment deemed to be necessary, and if we think that it will improve the quality of life, we will then look for a donor and source the equipment. And we have done a lot of good work on it, not only giving equipment but full-fledged centers. The laboratory in Miawali was set up initially to help with the screening of people with potential breast cancer. And that has evolved. Now it is doing all sorts of tests. Not only is helping the community, but any surplus income that comes is helping run the breast center. We did a thalassemia center in Parachanar, and the results is phenomenal. The unfortunate children who suffer with thalassemia not only go for the treatment, but there's investigation lab as well. Only recently, we gave 2 renal dialysis units in Karachi, We supported Arusha Dispensary with their ultrasound machine. We supported Dar es Salaam and Mombasa and gave them lab analyzer.